In the two panels about the outbreak of pandemics and infectious diseases, there was a clear position that this is a real threat for the world community. When it will happen, nobody knows, but the specialists are sure that it will happen. So there are a lot of possibilities to minimize the impact of such pandemic or such disease. One is to work on the local level, to implement an early warning system, to combine it on early warning systems on regional and on global level, to keep a balance between public health and public health care and public health. So to have the early warning system as a means to control the outbreak to a wide extent. The real threat is that the international community is not prepared. There are some simulations done by the United Nations. It started 3 years ago. The specialists are very positive that they said they are able to maybe control to some extent such an outbreak, but if it would happen, the economical damage is huge, to between $2 and $3 trillion would be the damage, and surprisingly it's not the loss by casualties or by high rate of mortality. The point is that the efforts to prevent the spread of the disease will be 60% of this economical and financial damage, because people cannot go to work. So 35 states out of 192 member states of United Nations are involved in serious simulations, but there should be more efforts to conduct them. Still, there is a necessity of vaccination of people, because in the underdeveloped world the infant mortality rate is still high, and the big successes in these regions of the world and in these countries is done by local efforts and on national level. Surprisingly, it's not the impact of international efforts. So the combination of international efforts and national efforts should be strengthened and should be intensified. And only if all these efforts will be combined, this kind of epidemics, of pandemics which might come or which is expected, can be of minimal damage.